812, we welcome in our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health. How are you, Dr. B?
Hey, Tommy, I'm doing good. How about you?
I'm okay. I just want to warn you, there is no Jazz Fest this weekend. If by force of habit, you tend to head out there on Friday, tomorrow, okay?
I know. I think I ate enough in the last couple of weeks. So.
It's over. So chronic pain, that's what we're going to talk about this week. It affects about 20% of American adults, and while it's one of the most common reasons adults seek medical care, the condition can be hard to recognize and diagnose. Dr. B is going to walk us through it here about chronic pain and how to spot and manage symptoms. And I guess the first thing, Doc, we got to talk about is what is pain?
Yeah, so, pain is really just any uncomfortable sensation that a person has, but it's typically caused by, either an injury or an illness. And a lot of times pain can be kind of good because it can be a warning sign that something isn't right, something going on in your body isn't right. So an example of that would be, a stomach ache. Everybody's had a stomach ache in their life, and so it could be something simple like indigestion, could be a stomach virus, but it could also be a sign of something like appendicitis. So it may be a warning that you need to, seek treatment for something that's going on. The other thing pain is really important for is it really signals, a behavior that you're doing that may be harmful to you so that you need to stop doing it. An example of that would be when you touch a hot stove, the sensation goes to your brain and it tells you to pull your hand away so that you don't burn yourself and cause a more serious injury.
It's a kind of ethereal thing because I can't feel your pain. I don't know what's going on inside of you. If you got an open chest wound, I can see that. But what's going on inside of our bodies here? What are we feeling? How does that work?
Yeah, it is different for everyone, and everyone senses pain in a different way. And so the way it works is actually relatively simple. What happens is anytime, your body experiences something harmful, it activates these pain receptors that are in your skin, or they can even be inside the organs in your body. Those are called nociceptors. And what those receptors do is they send a pain signal through the nerves from that injury site all the way up the spinal cord to your brain. And then your brain has to process and receive that signal and then send something back to the injury site, and that's actually the sensation you feel as pain. And all of that happens within, milliseconds.
There are different types of pain, I guess?
Yeah, absolutely. There's really two main types of pain, acute pain and chronic pain. So acute pain is usually caused, like I was talking about, a specific injury or maybe a health condition. So for example, if you break a bone or you have a cut to your skin, you're going to feel pain suddenly. It doesn't last very long, and it ends once the body is healed from whatever's causing it.
And what about chronic pain?
Yeah, chronic pain is different. It doesn't go away very quickly. In fact, the definition of chronic pain is that it lasts for at least 3 months or more. And that pain, though, could be a constant sensation, or it may actually come and go. It may be, barely noticeable, but, then exacerbate over time. But either way, chronic pain really interferes with daily life. It makes it difficult for people to work, go out and enjoy themselves and really take care of themselves.
What are some of the causes of chronic pain?
Yeah, sometimes chronic pain does have an obvious source. A long-lasting illness, something like arthritis or certain types of cancer can cause pain, and you can pinpoint exactly what's going on. Certain injuries and health conditions can also leave the body really more sensitive to pain even after they've healed. So after the stimuli is gone. An example of that would be nerve damage. A lot of diabetics can develop neuropathy, and that pain can actually persist for a very long period of time. Chronic knee injuries and back sprains, those can have pain that actually can come and go as well. But a lot of people can have chronic pain with really no obvious cause, and so there's tons of research that's going on to kind of determine how can people develop pain in the absence of a specific injury or illness.
Are there signs of chronic pain?
Yeah, really the defining symptom is a persistent pain that's anywhere from mild all the way up to severe. And it can be anywhere in the body. And like we were saying, it feels very different from person to person. You can't tell what someone else's pain feels like, and they can't tell what yours feels like. But some things that are very common that go along with chronic pain are things like fatigue, maybe trouble sleeping, and even a loss of appetite.
I know somebody, a woman, mid-40s, has a bad elbow, and it's amazing how it can impact so many different things, including mental health. Not that she's got any kind of insanity issues, but I think it can kind of get you down and wear you out.
Yeah, absolutely. Chronic pain, because it interferes with your daily life, it can make it very difficult to connect with other people and, sometimes just to do simple tasks around the health and around the house. And so it really does take a toll, on people's mental health. And, people with chronic pain are actually 4 times more likely to have depression or anxiety. And both of those, depression and anxiety, can actually make your sensation of the pain even worse. So that can create a negative cycle that gets really difficult to break over time.
I would think it's downright exhausting as well.
Yeah, exactly. It's very difficult to deal with that sensation all the time. And sometimes when it comes and goes, people don't know when it's going to happen. And so it can affect you when you least expect it.
Is chronic pain more common as you age, as people get older?
Yeah, it definitely is. You can develop chronic pain at absolutely any age, but it is more common in older adults. And the reason for that is because a lot of chronic pain can be related to certain types of medical conditions. And because as we age, we develop things like diabetes and arthritis, that can actually lead to these ongoing pain-type symptoms. But the really important thing to remember is that chronic pain is not at all a normal part of aging. So if you are having persistent pain, you want to talk to your doctor, explain the symptoms, regardless of your age and what's going on with you, because you need to determine what the cause is if you can.
Let's take a quick break. We'll pick it up here. We'll come back. We're talking to our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about pain, acute, which is like when you break a bone or something, and it happens once, I guess, and chronic pain that happens over a long period of time. If you have any questions or comments, 504-260-1870. It affects about 20% of American adults. And we'll talk about treatment for chronic pain when we come back. 8:20, it's time for traffic on WWL. 8:25 and a half, Tommy Tucker, WWL, talking to our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health, about chronic pain. It affects about 20% of American adults. It's one of the most common reasons adults seek medical care, but it can be hard to recognize and diagnose. And Dr. B, how can chronic pain be treated?
Well, yeah, we can. We can treat the pain itself, but when we identify a specific health condition that might be causing the pain, if we treat that condition, usually the pain is going to go away. So, an example would be arthritis in your knees. We can treat that arthritis and sometimes end your joint pain. In those cases, though, where there's really no obvious cause of the pain, we have to get a little more creative. There are a lot of medications. If you go to any local drugstore, you're going to see an entire aisle of over-the-counter medications that can be used for pain. There are prescription pain medications as well. I like to really focus a lot on occupational and physical therapy. It really works well. It helps to strengthen your muscles. It can actually help you compensate with pain as well. And then we absolutely shouldn't discount, just healthy lifestyle changes. What's really important is kind of using a combination of all those things. That's what's most effective in treating chronic pain.
Who should you talk to about chronic pain? Where do you begin?
Yeah, the best place to begin is usually with your primary care physician. They're going to know about all your health problems. They're going to be able to look for causes of chronic pain, and if they can treat that cause, then like I was saying, your chronic pain may get better. You want to try to avoid referring yourself to a specialist for this because you don't know exactly what's going on, and you want to address the root cause issue and come up with kind of a safe and effective treatment plan that works for you. Another thing, too, we talked about how pain can increase your risk for anxiety and depression. And so it may be a good idea sometimes to talk with a professional counselor. They may be able to help you with kind of healthy tools and coping mechanisms that can help you deal with the pain while you're trying to look for other solutions.
And what about lifestyle changes? That's a way to help, maybe?
Yeah, lifestyle changes are absolutely critical when dealing with chronic pain. And when you live with that pain all the time, you want to find anything that can lessen that sensation. And if you do a few things, it can also improve your overall health, your medical health as well. Stress in particular makes chronic pain worse. It makes you feel more pain. It increases the number of hours you have with pain. And so you want to try to find things that can reduce your stress level. Things like meditation, yoga, deep breathing, anything that really relaxes you can be something that helps the chronic pain and get your mind off of it. And a really great stress reducer is exercise. We can't say it enough. Exercise helps so many conditions in the body. It absolutely helps chronic pain. It helps relieve stress. So something light, walking, swimming, but talk to your doctor about what is best for you, because you don't want to do anything to exacerbate the pain.
And how about diet?
Yeah, diet plays a huge role, and I know we talk about it all the time. It helps a lot of medical conditions, but it absolutely can help chronic pain. There's a lot of foods that we eat that are inflammatory type foods, things like red meats and processed grains and fried food. A lot of those things can actually cause inflammatory processes in your body, and that can actually make the pain worse. Another big thing to keep in mind is sleep is incredibly important. Sleep is your body's time to kind of reset and heal itself, and so you want to make sure you're getting enough sleep at night as well.
General rule of thumb I've found, if you're exercising and unless it's under the supervision of a physical therapist and it hurts, it's best to stop?
Yeah, that's that sensation. Your body's saying, don't do this. So if it hurts, cut it out.
After surgery, under the guidance of a physical therapist, sometimes you have to push yourself through it, but that's up to them to guide you.
Yeah, exactly.
Thank you, Dr. B. Appreciate your time. Dr. Brent Wallis, Chief Medical Officer of People's Health. If you want to find out more about People's Health, you can go to peopleshealth.com. You can visit the People's Health Medicare Center, 3017 Vets in Metairie. You hear Newell talk about that all the time. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765. And you can always follow People's Health on Facebook, Twitter, and Instagram. When we come back, we're going to talk with Walt Leger, New Orleans and Company, about how they market the city and respond to crime concerns. Right now, we pause for WWL First News, and for that, we go to Dave Cohen.